Welcome to Learning Session 1 of the National Nursing Home Quality Care Collaborative. We are trying something new. Because we know sending team members to in-person learning sessions is difficult and expensive, this first learning session is comprised of 4 short recorded webinars, each followed by a team activity. Each webinar and activity should take about 1 hour to complete, and we ask that your team completes the 4 webinars and activities in 5 weeks. At the end of this webinar series, your team will have identified actions that you can take to strengthen your nursing home's quality culture and will have created the foundation for a performance improvement project. We know that many of you are already working on a performance improvement project. What you will learn through Learning Session 1 will help you strengthen the work you are already doing. In this webinar and throughout the collaborative, we will focus on the strategies that will strengthen your nursing home's quality culture. The objectives listed on this slide will be covered in the 4 webinars of this series. I knew that I wanted to be a nurse, so I secured a summer job prior to entering college as a nursing assistant in a local nursing home. On my first day, I was overcome by the smell of urine and folks slumped over in wheelchairs. Though there were a few residents I grew fond of, it was a depressing experience. I made it through the summer, but I vowed I would never again work in a nursing home. 12 years later, I broke that vow. I had young children, my husband was out of work, and I needed an easy, stress-free job. I found out that this was hardly an easy job, and it certainly wasn't stress-free, but I quickly discovered that I liked being able to form relationships with the folks living there. However, this wasn't a place where I wanted to live. Meals were delivered with plastic brown covers and often included cold, mushy peas or limp green beans. Many residents were tied to their chairs or beds. These were also the days of treating pressure ulcers with wet-to-dry dressings. I can still feel the resistance of the 4x4 as I ripped it off some poor soul's backside. The quality of care and the quality of life for these folks was not great, but we didn't purposely provide substandard care. We thought we were doing the best we could. We are people who want to improve nursing home quality now and in the future, when some of us may call a nursing home our home. And many things have improved. Few of our residents are physically restrained, pressure ulcer prevention and treatment are guided by evidence-based practices, and we are providing more resident-directed care. But things can be better. In 10 years, we will be horrified about things we are doing now. We hope to meet the needs of residents in an environment where there are enough qualified staff to provide exceptional care, staff and residents partner together and feel safe to make suggestions for improvement, and communication and documentation systems allow more time to joyfully spend with residents. To make our dreams a reality, we need to design and nurture systems that expect and embrace change within a culture that supports quality improvement. Changing culture is hard, and it takes time and commitment. This collaborative will give us the opportunity to figure it out together. We will use the change package as our guide to help implement strategies that lead to a culture that supports quality. I want to share a story about Fred, one of our elderly neighbors. In the past few months, my husband, as well as the local regulars at the coffee shop, noticed that Fred was failing. Eventually, he stopped showing up at the coffee shop, so my husband checked on him at his son's home where he was living. It turns out that he was having pain in his lower extremities, so he was having trouble walking the few blocks to the coffee shop. He had also lost about 40 pounds. Fred's family appeared to ignore his needs. My husband, worried that Fred was not getting enough to eat, started driving him to the coffee shop where the locals made sure he got something to eat. Fred continued to lose weight and complained of tremendous leg pain. One evening, he ended up in the emergency room. An assessment revealed that it was not safe to return to his son's house, so Fred ended up moving in with us for a bit. We cleaned him up, gave him some new clothes, and made sure he got plenty to eat. And we made sure he got to his doctor's appointments. After an appointment with a vascular surgeon, he was scheduled for an angiogram. Following the angiogram, he was assessed by the hospital social worker, who determined it would be safest for him to be admitted to a local nursing home. That is where Fred is currently living. Fred's story is similar to many elders that have a need to make a nursing home their new home. 1.4 million Americans reside in the nation's 15,600 nursing homes. How can we assure that these individuals and an even larger number of their family members and friends can count on nursing homes to provide reliable, high-quality, person-directed care in a home-like environment? What are the strategies that we should have in place to make sure that Fred's stay in the nursing home goes well? The first strategy is to lead with a sense of purpose. A quality organization is grounded in leadership that shapes the culture of the organization. Typically, the organization's leadership develops mission, vision, and/or value statements that drive the actions of their organization. I read the mission statement of the nursing home where Fred is currently living. A few phrases in their mission statement, including that individuals are respected and choices are honored, stuck out to me. I wonder if Fred has felt respected and if his choices are being honored. On admission, was Fred interviewed to learn what his preferences are? For example, what he likes to eat, when he likes to get up in the morning. I know he's a late sleeper. And does he have everything he needs? We didn't have shaving cream, and he wasn't too thrilled about that. What is it that makes a leader one that you would like to follow? For me, I know that I place more stock in what a leader does than what a leader says. For example, I worked in a nursing home for years before I even knew who the administrator was. I wouldn't say that demonstrates good leadership. This was definitely not a person who rounded, talking directly to staff and residents, or participated in meetings. Without getting the valuable information he could learn from the residents and those who actually are doing the work, how could this leader drive improvement? How would he even know what he needs to be improved? On the other hand, I've also known leaders who know all residents and staff by their names, are visible every day, set clear expectations, and encourage participation and welcome ideas. These are the type of leaders that are responsive to the needs of the staff and residents and enable others to achieve the shared mission and purpose of their organization. The next strategy is to recruit and retain quality staff. If you do not have enough staff, or you don't have staff that are a good fit, it's not possible to improve the quality of your home. Your staff is the touchstone of quality. These are the people doing the work and living the mission statement and values. Finding enough staff to work in nursing homes is difficult. So I wonder how Fred's nursing home finds quality people and keeps them there. Are new staff welcomed and given the tools and training they need to do their job well? Is leadership getting feedback from new orientees so they know how things are going and how they can improve their orientation program? Do they feel empowered to make changes and provide solutions? Do staff have a reason to stay? For example, is the schedule flexible? Are they supported in their professional development? Are there fun things planned to foster a sense of family and community? And is staff satisfaction measured regularly? The next strategy is to connect with residents in a celebration of their lives. We are all taught the golden rule: treat others as you would like to be treated. That sounds like a great goal, but when you really think about it, we should be treating others how they want to be treated, not how we want to be treated. And this starts at admission. Is the staff making an effort to get to know Fred? I wonder if residents and families at Fred's nursing home are asked for input and participate in their quality improvement activities. I wonder if they can tell me what has changed based on feedback from the residents and families. Fred is an important part of our community. I've been happy to see that the nursing home has encouraged his friends to pick him up and take him to the coffee shop. I also know that Fred has advanced congestive heart failure and that it's best to make end-of-life decisions now, while he still has the mental capacity to make his preferences known. I hope that this nursing home has trained its staff well in providing compassionate end-of-life care. Strong teamwork and communication is an essential component of a culture that supports continuous quality improvement. Fred was quickly admitted to a large nursing home directly from the hospital. What if Fred was admitted at a busy time? Did staff pitch in and help each other so that Fred received the physical and emotional support and attention he needed during this stressful time? Is there a formal method for communication between shifts? What if the housekeeper and maintenance staff notices that Fred appears to be in pain? Do they know who to go to advocate for his needs? Are all staff empowered to call a quick huddle to talk about changes in Fred's condition? Fred can afford to lose more weight. Will his dietary needs be well spelled out in his plan of care? And does all staff have access to his plan of care? Will his requests be passed from shift to shift? The next strategy is to be a continuous learning organization. An organization that practices quality assurance performance improvement, or QAPI, is one that is not complacent with the status quo, but is always looking for ways to improve. To be a continuous learning organization, staff need to be supported in their professional development so they can better contribute to care and service processes at the facility. Residents, family, and staff should all be involved in identifying areas of improvement and working toward solutions. In learning organizations, opportunities to improve are identified, change methodologies such as PDSA cycles are used to plan and test changes, and systems are analyzing, using methods such as flowcharting and root cause analysis. Then, data are used to track and report progress toward goals. All of this needs to be done in an environment where staff, families, and residents feel safe to report issues or problems immediately without fear of retaliation. This can only happen when the culture does not punish for mistakes or tries to find out who's at fault, but instead looks for how to improve the system to prevent problems from occurring. Next, a high-performing nursing home provides exceptional, compassionate clinical care that treats the whole person. I think you will find very few persons in healthcare who do not strive to provide exceptional clinical care with compassion. Providing care with compassion and anticipating needs can only be accomplished by knowing each resident well, their likes and dislikes, what hints that may indicate that they are in pain, hungry, bored, or need assistance to use the toilet. That is why consistent assignment is so important. I know that it took me a few days to make Fred trust me when he was at our home. Although he talked to my husband a lot, he was reserved with me until I spent some time listening to his stories about what it was like being a trucker. Then he started opening up to me. Once the resident and her family knows and trusts you, you will learn these subtleties that will help prevent problems such as pressure ulcers, falls, unnecessary hospitalizations, and the inappropriate use of antipsychotic medication, as well as boredom, loneliness, and sadness. The last strategy is to construct solid business practices that support your purpose and mission. If you don't have solid business practices, your nursing home may not be able to stay open, let alone thrive. Nursing home leaders are striving for new reimbursement models to provide resources to keep our doors open and provide the best care we can for those living and working there. In some states, there are pay-for-performance programs that reward high quality by providing incentive payments. If your state has that opportunity, take advantage of it. However, waiting for federal and/or state legislation to support your higher reimbursement may not be a strategy that will sustain your home. Many high-performing homes have explored innovative ideas to generate revenue, such as leasing unused space, seeking grant money, or organizing fundraising opportunities. You may also find that as quality of your home improves, your referrals may increase. Don't be afraid to share your resident and family satisfaction results with your community. Let them know that others see you as a great place to live. Create opportunities for staff to be involved in cost-saving conversations. Let everyone know that their ideas are valued. These strategies, as well as the action items, are intended to stimulate creative and critical thinking and can be found in a change package that was created following CMS's study of high-performing nursing homes. The strategies and action items come from conversations and observations of staff at all levels of the organization. Also included in the change package are 3 bundles focused on what nursing homes in the last National Nursing Home Collaborative did, as well as evidence-based practices to reduce the use of inappropriate antipsychotic drugs, maintain and improve resident mobility, and reduce healthcare-acquired infections. Now, or within a week of listening to this recording, sit down with your team to review the 7 strategies that are found in the change package and complete the team activity. First, review your organization's mission, vision, and/or value statements and answer the questions on the slide. Next, review the change package. Check things you are doing well, and highlight good ideas that would add to the quality culture of your home. Then, choose one action item your team will commit to work on by June 30th, 2015. A worksheet with these action items are included in the learning session handouts. In addition, there are 2 open calls scheduled for May 19th and June 9th. If you would like, please use these calls for questions or comments you may have regarding information learned in the learning sessions and/or the team activities. This concludes the first webinar for Learning Session 1. Please complete the team activity and then move on to Learning Session 2. For questions, please contact the appropriate person listed on this slide. This concludes Webinar 1 of Learning Session 1.